What is a panic attack? A panic attack is a sudden, intense surge of fear or discomfort that reaches a peak within minutes and triggers severe physical and emotional reactions. Panic attacks can happen unexpectedly and often without a clear reason, making the person feel as though they're losing control, having a heart attack, or even dying. Panic attacks can occur in isolation or be part of panic disorder, where they recur frequently and cause ongoing concern. Symptoms of a panic attack: physical symptoms, rapid heart rate or palpitations, chest pain or discomfort, shortness of breath or difficulty breathing, sweating or chills, trembling or shaking, dizziness, lightheadedness, or feeling faint, nausea or abdominal pain, numbness or tingling in hands or feet, paresthesia. Psychological symptoms: intense fear of losing control or going crazy, fear of dying, a feeling of detachment from reality, derealization, or self-depersonalization, a sense of impending doom or danger. A panic attack typically lasts between 5 to 20 minutes, though some symptoms may persist longer. The attacks often come on suddenly and peak rapidly. Causes of panic attacks: the exact cause of panic attacks is not always clear, but contributing factors may include genetics. A family history of panic disorder or anxiety may increase your risk. Stress, life stressors for example, loss of a loved one, job changes, or ongoing chronic stress. Brain chemistry, imbalances in neurotransmitters such as serotonin, norepinephrine, and GABA. Medical conditions: certain conditions like thyroid problems, heart issues, or respiratory disorders may trigger panic-like symptoms. Caffeine and stimulants, excessive intake of stimulants like caffeine or drugs, like amphetamines, can induce panic-like symptoms. How to deal with panic attacks? Immediate strategies. If you experience a panic attack, here are some immediate strategies to help manage it. 1. Controlled breathing. Focus on slow, deep breaths. Inhale through your nose for a count of 4. Hold for a count of 4. Then exhale slowly through your mouth for a count of 4. This can help reduce hyperventilation and calm your nervous system. 2. Grounding techniques. 5-4-3-2-1 technique. Focus on the present by listing 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This helps distract your mind and ground you in reality. Touch something. Holding onto an object like a soft toy, ice cube, or something cold can help bring your focus back to the present moment. 3. Positive self-talk. Remind yourself that this feeling is temporary and will pass. Panic attacks can feel life-threatening, but they are not harmful in themselves. Saying things like "this is just anxiety, it will be over soon," can help calm your mind. 4. Engage muscles. Tensing and then relaxing your muscles helps release the tension built up during the panic attack. Start from your feet and work your way up your body, progressive muscle relaxation. 5. Practice mindfulness. Focus on your senses, what you can feel, hear, or see, to take your mind off the fear. Practicing mindfulness regularly can also reduce the frequency and severity of panic attacks over time. 6. Leave the situation if possible. If the panic attack occurs in a triggering environment, such as a crowded space, consider stepping outside or moving to a quieter area where you feel more in control. Long-term treatment for panic attacks. For those experiencing recurrent panic attacks, long-term management strategies are key. Effective treatments include cognitive behavioral therapy, CBT, medication, and lifestyle adjustments. 1. Cognitive behavioral therapy, CBT. CBT is one of the most effective treatments for panic disorder and panic attacks. This therapy involves identifying and challenging negative thought patterns that contribute to panic. Exposure therapy. Gradually exposing the individual to panic-inducing situations in a safe and controlled manner to reduce the fear over time. Relaxation techniques. Teaching patients how to manage symptoms through relaxation exercises such as deep breathing and mindfulness meditation. 2. Lifestyle modifications. Regular exercise, physical activity, such as aerobic exercise, can help reduce anxiety by releasing endorphins and improving overall mood. Reduce caffeine and stimulants. Limiting caffeine intake, especially if you are prone to anxiety, can help prevent panic attacks. Healthy sleep habits. Ensure you're getting enough sleep, as lack of rest can trigger anxiety and panic. Dietary adjustments. Eating regular, balanced meals and avoiding alcohol and excess sugar can stabilize mood and reduce anxiety. Practice mindfulness and meditation. Daily mindfulness practice helps reduce overall anxiety levels and builds resilience against panic attacks. Medications for panic attacks. For those with frequent or severe panic attacks, medication may be prescribed. Below are the most common types used to treat panic attacks and panic disorder. 1. Selective serotonin reuptake inhibitors SSRIs are the first-line treatment for panic disorder. These medications help regulate serotonin levels, reducing anxiety and panic attacks over time. Examples: sertraline Zoloft, fluoxetine Prozac, paroxetine, Paxil. SSRIs typically take a few weeks to show full effects, and they may cause mild side effects, such as nausea or insomnia, in the initial weeks. 2. Serotonin norepinephrine reuptake inhibitors SNRs. SNRs increase both serotonin and norepinephrine, helping to control mood and anxiety. Examples: venlafaxine, Effexor, duloxetine. Like SSRIs, SNRs may take several weeks to become effective and may initially cause side effects. 3. Benzodiazepines are fast-acting medications used for short-term relief of acute panic attacks. They work by calming the brain and nerves, central nervous system depressants. Examples: alprazolam Xanax, clonazepam Klonopin, lorazepam Ativan. These medications are highly effective for short-term use, but carry a risk of dependency and tolerance. They are generally not recommended for long-term treatment. 4. Beta blockers like propranolol are sometimes used to control the physical symptoms of anxiety, such as rapid heart rate and trembling. They are not typically used as a primary treatment for panic disorder, but can be helpful for situational anxiety or performance anxiety. 5. Tricyclic antidepressants TCA. These older antidepressants are less commonly used but can be effective in treating panic disorder. Examples include imipramine, tafranil, and clomipramine and Afrinil. They tend to have more side effects than SSRIs and SNRIs. 6. Buspirone. Buspirone is an anti-anxiety medication that may be used for long-term treatment of generalized anxiety disorder and panic disorder. It takes longer to work than benzodiazepines but does not carry the same risk of dependence. When to seek help. If panic attacks are interfering with your daily life, or you feel unable to control them on your own, seeking professional help is crucial. A doctor or mental health professional can help determine whether you have panic disorder or another underlying condition and can recommend appropriate treatments. Emergency care. If you are experiencing severe chest pain, difficulty breathing, or believe you are having a heart attack, seek emergency medical attention immediately. Though panic attacks are not life-threatening, it's important to rule out other serious conditions. Conclusion. Panic attacks can be overwhelming, but they are manageable with the right treatment and coping strategies. A combination of cognitive behavioral therapy, lifestyle changes, and medication can help you regain control over your anxiety and improve your quality of life. If you experience recurrent panic attacks, professional support is crucial to tailor the right approach for you.